Hi all, today I'm going to take the topic clinical picture of alcohol related disorders, which is the first module. There are four main points which is included in clinical picture of alcohol related disorders. There are alcohol effects on the brain, development of alcohol dependence, the physical effects of chronic alcohol use, psychosis associated with severe alcohol abuse. First one, alcohol's effects on the brain. Alcohol has complex and seemingly a contradictory effects on the brain. At lower level, alcohol stimulates the certain brain cells and activate the brain pleasure areas, which release opium-like endogenous opioids that are stored in the body. At higher levels, alcohol depresses the brain functioning and inhibiting one of the brain excitatory neurotransmitters and which in turn slow down activity in part of all the areas of the brain. Inhibition of glutamate, the brain impairs the organism's ability to learn and affect the higher brain centers, including impairing judgment and other rational process and lowering self-control. People with alcohol use have seen some degrees of motor uncoordinations. And also, the drinkers have a difficulty in discrimination and perception of cold and pain, etc. Typically, the drinkers experience a sense of warmth, expansiveness, and well-being. In such a mood, pleasant and unpleasant realities are screened out, and the drinker's feeling of a self-esteem and adequate rise. Right? Here we can say a new word that is intoxication, which means the condition of having physical or mental control markedly diminished by the effect of alcohol or drugs. Here, in general, uh, the intoxication is determined by the amount of alcohol actually concentrated in the body fluid, not the amount that the person consumed. The effect of alcohol vary for different drinkers depending on their physical condition and the amount of food in their stomach and the duration of their drinking. In addition, alcohol users may gradually build up a tolerance for the drug so that ever increasing amount may be needed to produce the desired effect. Excessive drinking can be viewed as a progressing process. When a person becomes an alcoholic, he or she may travel through some stages, which is early, middle, and late stages. Many investigators have maintained that alcohol is a dangerous systemic poison, even small amounts, but others believe that in a moderate amount it is not harmful to most of people. For a pregnant woman, however, even moderate amounts are believed to be dangerous to uh, a pregnant woman. Fetal alcohol syndrome. It's a condition that is caused by excessive alcohol consumption during pregnancy that results in birth defects such as mental retardation. Next, we move on to the physical effects of chronic alcohol use. For individuals who drink to excess, the clinical picture is highly unfavorable. When a person taken a drug or alcohol, around 85% of alcohol is diffused with your blood and approximately 50% that is eliminated through the blood, urine and perspiration. The work of alcohol metabolism that is done by liver. But when a large amount of alcohol are ingested, the liver may be seriously overworked and eventually suffering irreversible damage. In fact, from 50 to 30% of heavy drinkers have a disease that is called liver cirrhosis, which means a disorder that involves extensive stiffening of blood vessels. Alcohol is also a high caloric drug. A pint of whiskey which provides about 1,200 calories. And also the consumption of alcohol reduces a drinker's appetite for other food because alcohol has no nutritional value. The excessive drinker can suffer some kind of malnutrition. Furthermore, heavy drinking that impairs the body's ability to utilize nutrients. Next, psychosocial effects of alcohol abuse and dependence. Various physical problems which is seen in alcohol abusers or alcohol dependent persons. A heavy drinker usually suffers from chronic fatigue, organ sensitivity, which includes aggression, anxiety, and also depression. Initially, alcohol may seem to provide a useful crutch or tool for dealing with the stresses of life, especially during a period of acute stress, which help a person to screen out intolerable realities and enhance the drinker's feeling of adequacy and worth. The excessive use of alcohol eventually becomes counterproductive, however, and it can result in impaired reasoning, poor judgment, and gradual personality deteriorations. And also seen some behavioral issues. The person with alcohol abuse increasingly seen some less responsibility, loss pride in personal appearance, neglects spouse and family, and becomes generally touchy, irritable, and unwilling to discuss the problem. We can also see some judgment problem with alcohol uses. An excessive drinker may be unable to hold a job and generally become unqualified to cope with new demands of their job environment. General personality disorganization and deterioration may be reflected in their loss of employment and marital breakup. By this time, the drinkers' general health is likely to have deteriorated. They have problem with their brain and also the liver. The last point is psychosis associated with severe alcohol abuse. Excessive use of alcohol can result in severe mental health problems. Several acute psychotic reactions that fit the diagnostic classifications of substance-induced disorders. Such acute reactions usually last only a short time and generally consisting of some confusion, excitement, and delirium. There is some evidence that delirium may be associated with lower levels of thiamine in alcohol. These disorders are often called alcoholic psychosis because they are marked by a temporary loss of contact with reality. Among those who drink excessively for a long time, the reaction is called alcohol withdrawal delirium, that is formerly known as delirium tremens. In this, following a prolonged drinking when the person enters a state of withdrawal, slight noises or suddenly moving objects may cause us considerable excitement and agitations. The full-blown symptom, which means fully developed symptoms, they are disorientation for time and place. Second one, vivid hallucination. Third one, acute fear. Fourth one, extreme suggestibility. Fifth one, marked tremors of hands like shivering. Sixth one, other symptoms including perspirations, fever, a rapid weak heartbeat, etc. Second alcohol related psychosis is alcohol amnestic disorder, that is which is formerly known as Korsakoff syndrome, which is described by Russian psychiatrist Korsakoff in 1887, which includes the outstanding symptom is memory defect, is sometimes accompanied by falsifications of events or place. Persons with this disorder may not recognize pictures, faces, rooms, and other objects that they have just seen, although they may also feel that these people or objects are familiar.